Hello, everybody. My name is Maggie, and I'm from Weller Health Education at Lehigh Valley Riley Children's Hospital. Some of you may recognize me from when I came into your schools and taught you guys face-to-face. Some of you may not, and that is perfectly okay. What the Weller Center does is we travel to all these different schools all around the area, and we just teach different health programs. So I teach a lot of different things. I talk about things like mental health, so depression, anxiety. I'll talk about things like drugs or vaping. I'll even talk about puberty, which is my all-time favorite program. But for you guys today, we are talking about something very different. We are talking about vaccines and what the word vaccine means, how they're used, and why they're important. This is a really, really important subject for you guys to understand. Vaccines are very important in preventing disease and helping us to stay nice and healthy throughout our lives. So I want to talk about them. I want to talk about what that word means and help you guys to understand them a little bit better. All right, let's get started. All right, you guys, so let's get started talking about understanding vaccines, understanding what they are, how they work, and why they are important. So first, in order to understand a vaccine, we need to understand how somebody gets sick. So how does somebody get sick in the first place? Well, most illnesses are caused by mostly two things, viruses and bacteria. So those viruses and bacteria enter our bodies and they make us sick. They enter our bodies in many, many different ways. Sometimes they're in the foods that we eat, on the surfaces that we touch, and then we touch our face or our mouths. Or sometimes we breathe in droplets from coughing and sneezing. So if you're around somebody who's coughing really, really hard, their body is releasing all these teeny tiny little droplets, which contain viruses and sometimes even bacteria. And those enter our bodies and make us sick. That's how COVID-19 works. That's how the coronavirus works. Somebody has the coronavirus, they cough, they sneeze around us, or even just breathe around us, and we breathe in all those infected droplets, and then pretty soon our body starts to get sick. How are viruses and bacteria different? Well, they're different in two ways. First, let's talk about bacteria. So a bacteria is a teeny tiny little organism that can disrupt our body function and make us really sick. So there's a lot of bacterial infections out there. There's a lot of diseases caused by bacteria. A common disease that's caused by bacteria is something called strep throat. I'm sure a lot of you know what strep throat is. For me, I had strep throat so much as a kid. It hurts so much. And that strep throat is caused by bacteria. So bacterial diseases can be treated and cured. And they're cured with things called antibiotics, like penicillin. So maybe you guys have heard these words before. An antibiotic is a medicine that fights off bacteria. So anytime you guys have an illness that's caused by a bacteria, you're going to be given an antibiotic. And that antibiotic is going to fight off that bacteria in your body and make you feel better in only a few days. So bacteria are actually really easy to treat. They're a lot easier to treat than viruses because we have a cure. We have antibiotics. So anytime you have an infection, you're going to be prescribed that antibiotic and it's going to cure you of this bacteria that's in your body. All right, so now let's talk about viruses. So how are viruses different from bacteria? A virus is a little bit different. A virus is actually much smaller than a bacteria. They are teeny, teeny, tiny. Sometimes we can't even see them under some microscopes. So they are very, very small. When a virus enters our body, it's going to invade our cells. So for those of you who don't know what our cells are what make up living things. Cells are what make up your skin, your heart, your blood, your lungs. Our entire body is made up of millions and millions of cells. Now, sometimes a virus enters our body and it invades one of our cells. And it essentially turns our cell into a factory that's going to keep making more and more of that virus. And producing that virus kind of takes over our body and makes us feel really sick. Maybe you have a fever, you're coughing a lot, your throat hurts. Those are some really common symptoms of a virus. Now, common diseases that are caused by viruses include things like COVID-19, measles, and the flu. Those are all caused by viruses. There's so many different viruses out there, and they all can cause different diseases. Now, the really, really big difference between bacteria and a virus cannot be cured with an antibiotic. So antibiotics only work for bacterial infections. So if you have an illness that's caused by a bacteria, you can take an antibiotic because it will cure you. If you take an antibiotic for a virus, it's not really going to do anything. So viruses are not affected by antibiotics. So what can we actually do for viruses? Well, there's not a lot we can do. There's only a couple of things. So many viruses actually go away on their own. So think about when you have a cold. When we have a cold, there's not really a lot we can do except kind of stay home and wait it out. Colds are caused by viruses. There's many, many different kinds of cold viruses. And those make us sick and they make us feel pretty rotten, but unfortunately there's no medicine that can cure the common cold. So we pretty much just have to stay in bed, eat some chicken noodle soup, and wait for it to go away on its own. Sometimes those viruses can be really, really bad and make us feel really sick, and sometimes they need to be treated with other medications to help with symptoms. So for example, I don't know if you guys have ever had a stomach virus. I had one actually a couple of months ago. Oof, stomach viruses, if you had one, it's brutal. You feel really sick, you're throwing up all the time, and sometimes that's really uncomfortable, so you can take other medications, like things like Tylenol to help with a fever, or anti-nausea medication to help you stop throwing up. So those are examples of medications that just kind of help with the symptoms. If you guys have a cold, maybe you take things like NyQuil to help you go to sleep and kind of take away your fever. But there aren't medications that will cure a virus. There's actually very few viruses that have a cure, like with antibiotics and bacteria. So what can we actually do to stop a virus? The best way is to prevent ourselves from getting it in the first place with vaccines. So with viruses, we want to prevent getting it at all. How does a vaccine actually work? So a vaccine works by training our immune system to recognize a virus and fight it off. So vaccines inject the tools necessary to create antibodies in our bodies. So what is an antibody? Think of an antibody as like the police officers of our body. So anytime you get sick, antibodies are going to fight that virus or that bacteria off. Now, sometimes our bodies need to make specific antibodies to fight them off. So for example, if you guys have ever heard of something called chickenpox, a lot of kids get chickenpox. I had it when I was a kid. So once you get chickenpox for the first time, your body is going to make antibodies to fight it off. And from then on in your entire life, you're going to have these antibodies that recognize chickenpox. So anytime your body ever encounters that virus again, it already has the tools it needs to fight it off. It already has those antibodies to fight off the chickenpox virus. Antibodies are unique to every virus. So every time you get sick, your body is going to make these really special antibodies that are going to fight it off. And they are what stop us from being sick and even make us immune. So if you have chickenpox at all, you're going to be immune to it for your entire life. So for example, I had chickenpox when I was a baby, even before I can remember. And once I had chickenpox once, my body was able to produce those antibodies it needed, and now I am immune to it and I can never get chickenpox again. Now, sometimes though, we don't want to get people sick in the first place. We want to stop people from getting sick. So we use things like vaccines. So vaccines create that immunity in our bodies without having to get sick at all. Vaccines have been created to prevent many different diseases like chickenpox, smallpox, polio, measles, mumps, shingles, and even rabies too. Many of these illnesses are incredibly deadly. Sometimes people actually die from it before even be able to produce any type of antibodies at all. And thanks to vaccines, smallpox actually no longer exists. We call this eradicated. So there's no such thing as smallpox in the world today. So scientists have maybe smallpox in a lab frozen somewhere, but beyond that, smallpox does not infect anybody because we had enough people vaccinated where smallpox was no longer a problem. So kids receive many vaccines when they start school and then are immune for life. So before you start school when you're around 5, you actually get a ton of vaccines. So this way you guys are immune for when you have to go and interact with a bunch of different children. So many of you are immune to things like measles, mumps, chickenpox now too. So you guys are immune to all of these things because you guys got the vaccines for them. Does that make sense? Okay. So why does everyone need to be vaccinated? Why is it important that everybody has to get a vaccine? Well, some people can't get a vaccine due to medical conditions. Some people are allergic to the vaccine. Some people have really important illnesses that make it almost impossible for them to get it safely. So when everyone in society gets vaccinated, this creates something called herd immunity. Maybe you guys have heard that before. Maybe you've heard it in school or in the news or even hearing your parents talk about it. So let's talk about what herd immunity is. So here's kind of a little funny picture, but here's where herd immunity gets its name. We get the term herd immunity from actually buffalo. Kind of funny, right? So the reason we call it herd immunity is when buffalo are being hunted by wolves or any other predators, what they do is they get in a big circle and they put the little children in the middle. So they put the baby buffalo in the center and all the adults get around to protect those kids that are in the center. So this is why we call it herd immunity, because buffalo form this kind of circle herd to protect the young, innocent buffalo in the middle who could get seriously hurt or even killed by these mean wolves. So this is what buffalo do, and human beings actually do the same thing with vaccines. If everybody around us gets vaccinated, then that creates herd immunity, just like with those buffalo. We're protecting those people in the center. So babies who can't get the vaccine yet, adults who have serious medical illnesses and can't get the vaccine. So if everybody around us gets that vaccine, then we protect these people in the center from those viruses that could potentially kill them. That's why it's so important that everybody must be vaccinated. The more people who are vaccinated, the less likely it is for these vulnerable people in the center to get sick and even potentially die. So it is so important that everybody gets vaccinated. That's why you guys all get vaccinated before you start school. Because what if there's a kid at school who can't get the vaccine? And suddenly there's a virus going around and that could make them really sick or even kill them. So we protect other people, not just ourselves, by getting vaccinated. So vaccines are so important. And because of vaccines, some illnesses actually no longer exist, like smallpox that I was talking about earlier. All right, you guys, I hope you learned a lot from this video. I hope you guys enjoyed. I hope you learned a little bit about vaccines and now understand how they work and how they protect against viruses and learn a little bit more about diseases. All right, you guys? So please remember to keep wearing your masks. I know you hate it, but please remember to keep wearing them. Wash your hands often and keep social distancing. All right, you guys, have a great rest of your day. Thanks for watching. Bye.